Hi and welcome to Flinders University. I am Stacey George, the Academic Lead of Occupational Therapy. I was inspired to be an occupational therapist as it's action-oriented. You get out in the community and you engage with people in their workplace, their school, their local community. I have worked extensively in neurological rehabilitation, which is with people who had damage to their brain like stroke and brain injury. I've worked in acute hospital settings, in inpatient rehabilitation services and the community in people's homes and workplaces. And I've worked both across Australia but also internationally in the UK and Brunei. So why would you study occupational therapy or physiotherapy? You need to be interested in helping people and changing people's lives. In physiotherapy, you maximise people being active, you support people with chronic conditions, and you improve their quality of life by being active. As a physiotherapist, you work with individuals to manage their chronic conditions and to maximise their quality of life. Physiotherapists help people move well, stay well, and live full lives through being active. So what is occupational therapy? It's the age-old question. It's based on the word occupation, which is around how people spend their time during the day, what they engage in, whether they be social activities, leisure, work. So occupational therapists work to overcome barriers to that engagement in those chosen occupations, whether they be physical, how people move, emotionally and thinking-wise, so they work around reducing those barriers. So health is one of the fastest growing industries, both nationally and internationally, so you'll always get work in these areas. So physiotherapists and occupational therapists work with people across the lifespan. So you may work with pregnant women, with young babies, with young children at school, or older people in different environments. So there's a lot of variety in your careers. Occupational therapists provide individualised intervention that might focus on the person, their environment they're in, or the occupation that they're engaging in. So once again, that gives you lots of variety in your daily work. Physiotherapists work with people with musculoskeletal, cardiovascular and neurological conditions. Both physiotherapy and occupational therapy offer you a fulfilling career across a range of settings in Australia and internationally. So why come to Flinders? Flinders are leaders in health and care. Our students are highly sought after. Often they're employed before they finish their studies and very soon after. At Flinders, we provide exceptional support in your industry placements. We have dedicated staff in the clinical units that support you through the journey of that placement. You learn with other health professionals as students, which means that when you get out in practice, you can work with a team, which is really important for the complex health conditions that you'll be treating. Our physiotherapy and occupational therapy programs are internationally recognised, allowing you to work anywhere around the world. At Flinders, we're exceptionally connected to industry. We build networks as you study in both the university environment and the clinical and industry environments. We offer placements working in industry across a range of clinical areas. We have a strong connection to the Northern Territory, and you will do a rural placement while you're studying at Flinders, which will help you build the skills to get a job anywhere across Australia. We deliver on work-ready graduates, and as I mentioned, staff want to employ you when you finish. We're co-located at the Flinders Medical Centre, so we're clinically embedded for our courses. We offer really innovative teaching methods. We have an on-site health clinic where people from the community come in and receive intervention from you as a student under supervision. We offer simulated learning, so we simulate the real-world environment. We use actors. We also, in physiotherapy, use something called Mask Ed, where our lecturers dress up as real patients and they look really authentic with their sophisticated masks on. But what this allows you to do is to make mistakes. So you learn an environment that when you get out on your industry placements or out as a clinician, you feel competent and confident. Our degrees have flexible study options. Physiotherapy has internationally recognised certificates. So our teaching team ensure a supportive, student-centred environment. We have smaller cohorts, so we build strong relationships as soon as you walk in the door at Flinders, and those relationships last throughout your course, but also when you graduate out in the community. This small cohort allows us to have a personal approach to your learning so that we can support you through your challenges and work into your strengths. All members of our teaching team are clinical experts, so they bring currency to practice into your programs to ensure that you become the best occupational therapist or physiotherapist you can be. We use current evidence-based research into our teaching. Our staff are active researchers, so they create the evidence that informs the teaching. So if you're a person who wants to change people's lives, you could have a fulfilling career in occupational therapy or physiotherapy. Thank you for visiting Flinders University. I look forward to welcoming you on campus soon.